to come to the hospital.
Very interesting. I'm actually speaking at the church tomorrow morning. And speaking at the church because...
Okay, just give us a second. Bello is back. Hello, Bello. Bello, can you hear me?
Hello, good afternoon.
Good afternoon, Bello. What's your question?
Good afternoon.
Good afternoon. Your question. We can hear you. Hello.
Yeah, my name is Bello. I'm speaking from Rwanda.
Okay.
My name is Bello. I'm speaking from Rwanda.
Yes, we can hear. Go on.
I want to ask the doctor. I think child marriage contributes a lot to this. I schooled in the University of Maiduguri in the early 80s. And some of my co-students are medical students. We go to the dentistry hospital and the general hospital in Maiduguri. We discovered that 70% of cases at that time were as a result of child labor and early marriage.
Okay, thank you, Bello.
I think when we are treating this, we should encourage and talk about, allow our people to let the children become adults before they get married.
Thank you very much, Bello. Thank you very much. So that's what we were talking about just now. We're not saying get married so early. Yeah. Perhaps he feels there were more child fistula cases or young lady fistula cases because he was in the north. And typically they get married early.
I think, you know, I think that for every child that develops a fistula, it's a painful experience, but that we need to correct that impression. 25% of the cases are usually child brides. That's globally. In our country, we have a higher rate in the north of our country, but that is not the major cause of fistulas.
Okay, so let's talk prevention. How do we stop fistulas from happening? Because that's the aim now. Already there are so many on the ground to be repaired. How do we stop them? What are the methods?
Okay, well, if you want to look at stopping obstetric fistula, you have to look at it in three ways: primary, secondary, and a tertiary approach. Looking at the primary approach, like we said earlier on, women who are not supposed to be pregnant shouldn't get pregnant. Okay, we need to stop some women from getting pregnant until they want to get pregnant, until they feel they want to have a child. Okay, so and it comes into the fact that we need to increase our literacy level in this country. We need to put our girl child in schools. They need to go to school, have basic education. We need to educate our girl child. Educating the girl child reduces the incidence of child marriage.
Okay.
Okay.
She'll be busy with school, if nothing else.
Exactly. It empowers the woman, okay, to be able to have access to healthcare facility. If she's sick, she'll be able to go to the healthcare facility. Nobody needs to tell her to, hey, now go. She will know that when I'm sick, I need to go to the hospital and have access to this healthcare facility. Okay? So it's important to educate the girl child. Okay? Then if you look at it that way, now, we also need to increase our contraceptive prevalence in the country.
Okay.
Such that women who don't want to get pregnant don't get pregnant at all. They need to be on contraception as much as possible.
Let's quickly take this call from Peace. Hello, Peace. Peace, are you there?
Hello.
Hello. What's your question, Peace?
Yes. Hello, good evening.
Hello, Peace. What's your question? Go ahead.
Are you hearing me?
Yes, I can hear you.
Okay. The question is that, like, assume you have a child, and the child is not up to the year, and you want to kill, then what will you do? What will you do? Will you continue feeding that boy breast milk or I don't know?
Okay, Peace, that is a question for another day. I'm sure we'll be having a program where we talk about having children close together, but today we're talking about fistulas, but thanks for calling anyway. Okay, so let's just take a quick break. We'll be back in a minute. Welcome back, and let's finish what we're saying about prevention. Prevention is key. So we don't have any more fistulas.
Prevention is the answer to fistula eradication. So as you saw from the numbers which you quoted earlier on, there's a wide variation. We have between 2 million and 4 million.
4 million.
You have some other people say 1 million. So we haven't done a fistula
So clearly
census.
there's a problem with the numbers.
There's a problem with the numbers, and as far as I'm concerned, what you can measure, you can manage. So we first need to do a fistula census. Prevention is key because for every woman that we treat, there are 20 new patients. And we also know that for every woman you treat, there are 49 or so who are not being treated. But all these numbers are estimates. To do a prevention program, we need to educate, just as the doctor had said. But education means bottom up, going to the wards, going to the local governments, educating the women and their husbands. In fact, what we did in Niger Republic was that on market day, whilst the women were at the market, we would go to the villages and explain to the men why it was important for a woman who was pregnant to be allowed to go and get antenatal care, because many times it's their husbands who take these decisions. And I have to tell you, 80% of the time, the men said, oh, they didn't realize that this decision that they were taking. So it wasn't
even that they knew and they refused?
No, some of them don't have any idea that the women have to go to hospital. So what we do is that in those villages, we find somebody who has an Okada or who has a keke. We say, okay, if somebody is pregnant, we monitor. The woman has to go and write her name down in a healthcare facility that's not far. The person who has the Okada or the keke will give some money so that he can fuel the vehicle,
and then he brings her to the hospital.
And we saw 75% reduction in the incidences of fistula. Now we can do that here, and that's why I'm working with some state governments to make sure that we can put that kind of structure in place.
Okay, Dr. Lawal, your last words on prevention.
Okay, my last word is that we need to invest in girl child. We need to invest in our women in this country, because if you invest in women in this country, you're investing in the whole nation. Basically.
Thank you very much. Thank you so much for coming. That was so nice. And thanks for listening in, and thanks for your calls. Do have a wonderful day. Mary Alale Yusuf.